Hello, this is Marla Dalton, Executive Director and CEO of the National Foundation for Infectious Diseases, or NFID. The widening circle of eligibility for COVID-19 vaccine booster doses has expanded once again and now includes all adults age 18 years and older. With me today is NFID Medical Director, Dr. William Schaffner, to help us understand the new booster recommendations. Bill, always wonderful to have you.
Good to be with you, Marla. As we've said in the past, when it comes to COVID vaccine, there's always something new.
Indeed. So jumping right in, Bill, can you give us a little bit of information on why booster shots are necessary now?
Well, sure. The short answer is that we have discovered that over time, this really excellent protection that we get against severe disease has, not surprisingly, begun to wane a little bit. That happens with other vaccines too, so that it means that we need a booster dose, a reminder to our immune system to keep up protection for all of us. And that seems to be very, very good. The studies show that if you get that booster dose, your antibody levels really surge up.
Great. So I'll ask the obvious question then. Are there any risks to getting a booster shot?
Well, the short-term risks are the same as when you got your first and second dose. Almost everybody will get a sore arm. I did. And some people get some chills, feel poorly, may have some aches and pains, a headache, a degree of fever. That abates. The more serious side effects, which are very, very rare, the one that's been under most discussion, of course, is this inflammation of the heart muscle, myocarditis, which occurs more in younger adults and older teenagers, particularly boys, is very, very unusual. And so we anticipate that it will be comparably very rare after boosters.
Perfect. So Bill, is there anyone who should not get a booster at this time?
Actually, it's everyone older than 18, so not yet folks under 18 years of age. And on those rare occasions where someone has had some sort of reaction that concerns them after the first or second dose, or they have an allergy to an ingredient in the vaccine, of course, they should speak with their healthcare provider about whether the booster is appropriate for them. That should be very, very unusual.
Great. And then is it important to get a booster dose with the same type of vaccine as the primary series, or is mixing and matching okay now?
Mixing and matching is fine. It's great. So you don't have to be overly concerned with the brand you got initially and the one that's boosting. Get the one that's easiest and closest to you. Now, a little footnote, Marla. The folks who got the J&J vaccine, we have data to show that they're eligible for boosters 2 months after they got their initial J&J dose. They need a second dose. They can get that second dose with J&J. That will give them a boost. But there are data to show that if they had their second dose with one of the mRNA vaccines, Pfizer or Moderna, they get an even bigger boost. So although it's not an official recommendation, I've been suggesting that J&J recipients take a look at those data.
Interesting, thanks. So Bill, before we sign off, I'll end with anything else that you want to make sure that our listeners know at this time.
Boosting is important. We want everyone who's eligible for a booster, obviously, to come forward and get it for their own protection and helping to protect the community. But we have to remember, while people are looking for their third doses, as it were, there are 60 million adults, our friends and neighbors, who have not yet received their first. And so we need to keep our focus on persuading those good people to come forward and getting vaccinated. And while I'm talking about adults, let me also mention children. Children age 5 and older are now eligible for vaccination. They should be vaccinated also. So we have plenty of vaccination to do. And if I might add another footnote, it is influenza vaccination season. That's that other nasty respiratory virus. It's time, if you haven't received it yet, to get your flu vaccine. Remember, we should do that each and every year if we're older than 6 months of age. And I suspect that's everyone listening.
And just as a reminder, it's okay to get both a flu vaccine as well as a COVID vaccine at the same time, correct?
You can do that, right. They should be given either at least an inch apart in the same location on your arm, or one in each arm.
Great. Bill, thanks again for your valuable insights as always. We'll certainly look forward to continued discussions on a future episode of the Schaffner Report.
Everyone get vaccinated. That will lead to happy holidays.
Great. Thanks so much.